So with that in mind, today I would like to thoroughly discuss a profoundly important topic. Why is it absolutely essential to carefully analyze and comprehensively discuss the critical subject of special education, particularly as it relates to individuals on the autism spectrum with all of you present here today? Very often, what frequently happens is that if our young child is diagnosed as being on the autistic spectrum, we tend to simply just drop them off at a nearby local occupational therapy center for their specialized care. Now, if we leave the child at the OT center, it's certainly not the case that the child won't be worked with there or that there won't be any improvement. When we try to teach the child through command-based learning, the child will definitely learn something from that command-based approach as well. But is our goal just to teach the child something? If our child shows some improvement but still doesn't become like a completely normal child, are we satisfied with that? Absolutely not. When we know that with the right treatment, the right choice of herbs, and along with that, the right kind of chemicals, the right kind of herbs, like rather than giving sedative, nasty chemicals to your child, yes, it's always better that we choose Ayurveda. And in Ayurveda also, if we know which are the right kinds of herbs, because not every herb is meant for everyone, so if the herbs that are suitable for our child are used, those along with the right and appropriate herbs, if you also have the right and proper ABA, meaning the precise and accurate guidance, then you are well on your way to achieving your desired outcomes. Then definitely when both are combined, a child can live a completely normal life. So we shouldn't settle. We have to move forward not with partial improvement, but towards true absolute perfection. So we can see a question which is about an ADHD child. So I would also like to mention there that ADHD, attention deficit hyperactivity disorder, is very common nowadays, where a child's attention span, their concentration span, cannot stay focused on a particular topic for a long period of time. Now, in the case of ADHD, Ayurveda has certain herbs which, if used, can increase the concentration span. The child starts to concentrate better than before, and as soon as a child with ADHD increases their concentration span, there is nothing to worry about because the IQ level in an ADHD child was never low. When all the children are studying in class, it's not necessary that the child who doesn't answer the teacher's question has a low IQ level. It could be that the child is just not paying attention. There are many children who score low marks in the lower classes, but later on, in regular or professional colleges, they score very high marks. They do very well and are successful in life too. So never think that if a child isn't scoring well today, it means they don't actually have the ability to score well. They might have full potential within them. They just lack focus, and in an ADHD child, their attention doesn't stay on anything at all. That's why, for an ADHD child, our only task is to help them develop focus.
Autism is a temporary phase in the life of a child if treated timely.
This is the case study of Parth, a 3-year-old child diagnosed with autism. At a very young age, Parth showed multiple developmental challenges. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, poor understanding. Parth's detailed medical history was documented and evaluated before initiating treatment. In April 2023, Parth's parents consulted Dr. Navdeep Sharma and felt confident about the scope of treatment. A personalized Ayurvedic treatment approach was planned using specific herbal formulations to support neurological development. Braino R Plus, supporting attention and neurological response. Braino R enriched with Mandukparni, Kushmand, Ashwagandha, Amlaki, Jatamansi, Sarpagandha, and Ustakhudus. Braino A Plus, supporting calmness and behavioral balance. Braino A enriched with Shankpushpi, Brahmi, Shatavari, Bringraj, Shunti, and Vacha. Cucurbita oil, supporting nourishment and neurological health. Mukta Pishti, supporting mental stability and reduce irritation. Before treatment, Parth often showed irritative behavior and did not respond clearly to instructions.
करो
आ जाएगा वो
Within 9 months of undergoing treatment from Dr. Navdeep Sharma, Parth showed significant improvement.
कलर करो वेरी गुड पार्ट कलर करो नो इस हैंड से करते हैं इस हैंड से राइट हैंड वेरी गुड इसके अंदर रख दो वेरी गुड पापा का हैंड दीदी का हैंड पकड़ो वेरी गुड पार्ट चलो वेरी गुड खाओ वेरी गुड पार्ट तो बहुत कम
Hello parents, Parth, say hello. This is Parth, my son, he's about to turn 4 years old. Last year in July we went to Dr. Navdeep Sharma sir. A sir had told me about him. We never imagined that in just 9 months Parth would start saying mama and papa to us so soon. As a mother, as parents, we always longed for the day when we would hear Parth say mama and papa. Today Parth says mama, papa and everything else with understanding. By God's grace and with Sir's medicine and guidance, in just 9 months, Parth is now living a near normal life. And Parth was also in playgroup at school. Just 15 days ago, the teacher at school said that Parth will be moved to nursery, and the happiness that Sir has brought into our lives, what more could parents ask for than to see their child improve so quickly and so well? For parents, this is truly a big thing. Thank you, Sir. Thank you very much for bringing such great happiness into our lives. Thank you, Indian Roga.
Call now to connect with Dr. Navdeep Sharma and gift your child autism-free life